Mpox, formerly known as monkeypox, is a viral disease caused by the monkeypox virus, which belongs to the same family as the smallpox virus. It is usually milder than smallpox, but can be serious in some cases, especially in children, pregnant women, or people with weakened immune systems. How does it spread? Transmission. Mpox mainly spreads through close, skin-to-skin contact with someone who has the virus, particularly with their rash, blisters, or scabs. Other ways include sexual contact, including kissing or touching, sharing contaminated items like clothing, bedding, towels, or utensils. In some cases, respiratory droplets during prolonged, close face-to-face contact, contact with infected animals or their meat, more common in parts of Africa. A person remains contagious until all lesions have crusted over, the scabs have fallen off, and new skin has formed underneath. This can take 2 to 4 weeks. Symptoms. Symptoms usually appear 1-2 weeks after exposure and include fever, headache, muscle aches, fatigue, and swollen lymph nodes. This is a key difference from chickenpox. A rash that starts on the face, hands, feet, or genital area and can spread to other parts of the body. The rash turns into fluid-filled blisters and then scabs. Most people recover within 2-4 weeks with supportive care. Current situation as of April 2026. Mpox continues to circulate globally, with ongoing transmission of different clades, strains, including clade I, especially IB, in parts of Africa, and some spread to other regions through travel or community transmission. In Pakistan, cases have been reported in 2026, particularly in Sindhi province, including Karachi and Khairpur, with some in Punjab as well. Health authorities are monitoring and isolating cases. The overall risk to the general public remains low if proper precautions are taken, but vigilance is important. How to protect yourself from Mpox. Is saka se bacha jai sikta? Prevention is the best approach since the virus spreads mainly through close contact. 1. Vaccination. The most effective way. 2. The JYNIOS, also called MVABN or Imvamune vaccine, is recommended. It is given in 2 doses, about 4 weeks apart, and provides good protection, around 66 to 89% effectiveness after 2 doses. 3. It is advised for people at higher risk, such as healthcare workers, those with multiple sexual partners, or anyone who may have been exposed. 4. If you have been exposed recently, getting the vaccine within 4 days, up to 14 days, can prevent or reduce the severity of infection. 5. In Pakistan, availability may be limited. Check with your doctor, local health department, or hospitals for access. Older smallpox vaccines can offer some cross-protection. WHO supports vaccine efforts in affected areas. Daily preventive measures. Avoid close physical contact, hugging, kissing, sexual activity with anyone who has a rash that looks like Mpox or has confirmed infection. Wash your hands frequently with soap and water or use an alcohol-based hand sanitizer. Do not share or touch personal items, clothes, towels, bedding, utensils used by someone who is sick. If someone in your household has Mpox, isolate them in a separate room if possible, use separate bathrooms, and wear masks when interacting. Avoid contact with wild animals or their meat in areas where the virus circulates in animals. Cook meat thoroughly. Be cautious in crowded settings or events with lots of close skin contact. If you develop symptoms, isolate yourself immediately and contact a doctor or nearest hospital for testing. Treatment is mostly supportive, rest, fluids, pain, fever relief. In severe cases, antiviral medicines like tecovirimat may be used. Stay isolated until all scabs fall off and new skin forms. Mpox is not as easily spread as COVID-19 through casual air contact, but close personal interaction increases the risk. In Pakistan, health teams are actively tracing contacts and setting up isolation measures. For the latest updates, check official sources like the Pakistan Ministry of National Health Services, WHO website, or your local health department. If you or someone close to you has symptoms or possible exposure, seek medical help right away. Early isolation helps stop the spread. Stay safe and healthy. If you need more details on any part, like symptoms, treatment,